If you thought climate change was all about weather havoc and melting ice, it is not the case. Climate experts have now attributed Bangladesh's rising number of deaths of dengue, which now amount to more than 1,200, to ever-changing climate crises across the world. This has now taken a toll on Bangladesh's creaking public healthcare sector. Here's the story.
Abu Hassan is in mourning. His 6.5-year-old son died in July after contracting dengue, the mosquito-transmitted disease that has ravaged Bangladesh this year. So sudden it was, and so helpless he says he felt as darkness closed in.
The night time was very critical and I didn't get any support from the doctors. I went to every department begging for help in every way possible, aside from falling down to their feet. It is outrageous that no doctor was present at the pediatric intensive care unit, which provides critical care in a prestigious institution like Dhaka Medical College and Hospital. For 4 hours, my son didn't get any treatment here.
As of the 11th of December, more than 1,500 people, including 156 children, from newborns up to those aged 15, have died of dengue in Bangladesh this year. Over 300,000 cases have been registered, as per the government's Directorate General of Health Services. The previous highest, incidentally, was 281 deaths in 2022. The scale of this year's dengue calamity is visible here in hospitals stretched to the limit. And this even after public hospitals have added hundreds of beds. The system bursts at the seams with the patient influx. It's turned into the biggest health emergency Bangladesh has seen in decades. Doctors say there are many patients coming in with repeat cases, people who've tested positive for dengue for the second, third, or even fourth time. Experts have linked rising dengue numbers to rains persisting this year well beyond the monsoons, another symptom of shifting climate patterns. Exposing an unprepared and inefficient system unable to manage public health and sanitation.
There is a linkage between the climatic factor, this is especially temperature, humidity, rainfall. These are the 3 principal meteorological factors who triggered the Aedes mosquito densities as well as the virus growth and development. So dengue epidemic at that moment in 129 countries all over the world, and most of the countries is the tropical and subtropical countries, which countries vulnerable for climate change. And in this country, temperature, rainfall and humidity is suitable for the growth and development of Aedes mosquitoes as well as the dengue virus.
Which means the need to guard against longer transmission seasons for disease-carrying vectors. Waterlogging and humidity create just the vicious conditions the Aedes mosquito needs. Authorities have deployed emergency teams to coordinate anti-mosquito drives. Creating awareness on breeding possibilities of Aedes mosquitoes, which thrive in the region, is central to the plan. In the bigger picture, the climate health link came up in a big way and for the first time at the COP28 summit in the UAE, with the stress that much more needs to be done across the tropics and affected regions.
We already have a full package of interventions, of technical support that is available to countries, but what they really are lacking now is capacity in terms of technical capacity and access to those tools, but also concrete access to the financial resources that will allow to do the investments that they need at country level.
The World Health Organization has warned that diseases like dengue, Zika, chikungunya and yellow fever caused by the mosquito-borne viruses are spreading faster and further than ever before. Bangladesh is in the quicksand this time, no playing down the threat of others falling in next.